I'm Cecilia Theobald, and I'm the Quality and Safety Coordinator for FHD. This video will cover some of the basics and most frequently asked questions about the quality improvement requirements in the immersion phase, including details about how students can complete the quality improvement advanced track. As a reminder, all students are required to complete a quality improvement project during their immersion phase. This can be done via one of two tracks, the longitudinal track or the advanced track. In the longitudinal track, students will register for QI 1, 2, and 3 and will take these one per month concurrently with another rotation. Students have protected time on Tuesday afternoons to do this coursework. The advanced track is a self-paced experience. Whichever track you choose, we strongly recommend doing your QI requirement during your third year. Many people don't know exactly what they plan to do for residency, but if you already know what area you plan to apply for, we recommend you consider doing your project in your planned residency area, as this provides a great opportunity to talk about your project during residency interviews. Both of the tracks can be completed either alone or with a partner, and we recommend that students consider completing their project with a partner, as this sometimes affords additional flexibility. But this may, of course, affect when and which track you plan to complete. Finally, please remember that while this will not be covered in this video, in addition to the quality improvement requirements, all students must complete an additional longitudinal patient safety course prior to graduation and must register for this separately. We are excited to announce that beginning with the graduating class of 2019, both the longitudinal and advanced tracks will be graded on an honors, high pass, pass-fail scale. Students in the longitudinal experience will still register for all three QI 1, 2, and 3 courses. However, they will receive one final grade on the transcript, as will students in the advanced track. The honors grading criteria are the same for the longitudinal and advanced tracks and are available both in the syllabi and on the FHD website. And honors grading criteria are based both on project quality and on the performance on the knowledge assessments in the course. Students often ask which track would be better for them to complete. And the truth is that most projects can be completed via either track, and the choice has more to do with student preference. The longitudinal track offers more hands-on guidance and has less flexible interim deadlines to keep the projects moving along. This is typically a great choice for students who don't have a lot of prior QI experience or want more coaching. I want to also emphasize that although QI 1, 2, and 3 need to be done in order, they do not need to be done in continuous months. So if the project or the student's schedule suggests it would work better, the student can take time off between QI months. The advanced track offers a self-paced, less hands-on experience for students who need a little bit less project coaching or who need more time flexibility, but it does have earlier deadlines so that students who do not complete their QI advanced track experience by the end of third year will need to use the longitudinal track. Also, many students completing their QI projects through either the VPIL program or the Health Systems program will use the advanced track to submit their QI projects. Another common question is, for students who are doing the longitudinal QI requirement, what should they pair QI with? There's really the advanced track work can be completed at any time prior to the deadline, and there is no formal pairing requirement for the longitudinal QI courses. Many students choose to pair their QI months with their research projects, but I want to emphasize this does not work well for all projects, and we encourage students to consider the nature both of their research project and of their QI project when deciding if this would work well. For example, there are some bench research projects in particular that do not afford a lot of time flexibility, and these sometimes do not work well with QI. Some students often really enjoy doing their QI projects during clinical rotations, such as ACEs or other clinical experiences, and really enjoy working in the same environment that they're doing their project in. Whichever track you choose, you should not plan to do any significant portion of your quality improvement project during an acting internship or an away rotation. Another thing that comes up that students want to know is where they can find an idea for a project. Many students come in already with an idea for their project, but if not, we do recommend that students think about this before they begin the QI experience, particularly for those doing the longitudinal track. Some students will want to do a project in their future residency field, and they can begin by talking to mentors or clinicians in the field about ongoing projects. We also publish a great resource on the FHD website, which is highlighted here, a list of previously completed student projects. This will give you an idea of the right size and scope of a successful project, and students also indicate whether there is an opportunity for another student to do further work on the project. And I strongly recommend that all students in both tracks review this resource before choosing a project. If you choose to complete QI via the longitudinal track, you need only to register for QI 1, 2, and 3 and begin to think about a project before you begin. The remainder of this video is going to focus on the process of applying for and completing the advanced track. So the FHD website has a lot of dedicated information about the QI advanced track that I encourage you to take a look at, including links to the application, grading scales, the project list, templates, and other resources. In general, QI advanced track projects have 3 phases: project proposal, project completion, and the final application. This can be done at any point during the VMS 3 year, but all phases, including all data collection and applications, must be complete prior to the final deadline, which is September 30th, prior to your planned graduation. Students who have not completed all of the advanced track requirements by this deadline must complete QI via the longitudinal track. There is no formal deadline for the project proposal, the first phase, to be completed. However, we recommend allowing at least 2 to 3 months between the proposal and your final application, so project proposals should generally be submitted no later than mid-summer before graduation. The first step in applying for QI Advanced Track is to submit a project proposal. So before you do this, you will want to identify a general project area and a faculty QI sponsor. You will then meet with your sponsor, and you want to explore and understand a little bit about the background clinical problem and begin to think about the metrics that you will measure and what your aim statement will be. There are then some required IHI modules and readings that can be completed online at any time. Students will then begin to gather a little bit of baseline data to understand the scope of the problem, and then can begin submitting the REDCap project proposal application. At any point when you finish the IHI modules and readings, students can also do the first portion of the knowledge assessment. Once this project proposal application is submitted, students will then meet with me to talk about their project and adjust plans if needed. The second phase is project completion, and this is where students actually complete the meat of their project. So once the project proposal is approved, students will then begin meeting with their faculty sponsor. This needs to be done a minimum of 2 times throughout the project, but we recommend for longer projects that students meet at least monthly with their sponsor. Students will finish collecting any baseline data, will do some additional IHI modules, readings, and can complete the second knowledge assessment at any point, and will learn a lot more about process analysis and data collection. You'll then complete process analysis using 2 tools from a selection, including fishbone analysis, Pareto analysis, driver diagrams, stakeholder analysis, and the 5 whys, and templates for all of these are available on the Advanced Track website. You will then plan and implement a PDSA cycle or intervention and gather follow-up data. Students who want to be considered for honors credit can do a second PDSA cycle where they make an adjustment to their intervention and gather additional data. All students will be required to submit a run chart and a poster, of which we also have downloadable templates available on the FHD website. Finally, students are going to submit their final application. The absolute final deadline for this is September 30th, prior to your planned graduation. Prior to submitting this application, students must have completed all project components, including all of the online modules, all of the readings, and passed both knowledge assessments. And when they submit their application, you will upload a number of documents, including your IHI certificates of completion, your process analysis tools, your run chart, and your poster. And after this application has been submitted, you'll meet with me again to review your application as well as to talk about your tentative grade. We have been so excited to see the projects and the wonderful work that has gone on so far in QI, and I'm excited to see what you all will do in the future. As a reminder, the FHD website has a whole lot of information about the process and a lot of downloadable resources. At any point, if you have questions about QI in general, you are welcome to email me. For longitudinal track specific questions, you can either email Dr. Tammy Bradham or Dr. Scott Watkins, and you can always reach us at the FHD at vanderbilt.edu